Okay.
I thought it was like amazing.
Looks like we got everybody here for the Health and Human Services Committee. Madam Clerk, would you please call the roll?
Alderwoman Hubbard,
Present.
Alderwoman Green, Alderwoman Spencer,
Present.
Alderman Gunther,
Here.
Alderwoman Martin,
Here.
Alderwoman Navarro, Alderwoman Middlebrook, Alderwoman Rice,
Here.
Chairman Arnowitz,
Here.
6 present, have a quorum.
Thank you. We're here to discuss Board Bill 132 today, which is a grant coming through the Health Department. And I have Mr. Craig Schmidt here to come up and talk on this bill.
Thank you, Mr. Chairman, members of the committee. So this is good news in that we're asking for the city to accept the grant, and this is obviously the process for that. We appreciate the fact that you are looking at this. It's an opportunity for us to create what's called a community resource response team. We want to go out on the opioid overdose cases. This grant primarily would deal with the predictive analytics piece of that, trying to put together, as you know, all kinds of people have silos of information throughout the city, throughout the state, actually also with DEA and other places, and nobody's really putting that together, so there will be an expense associated with that. This largely is to cover that, but also for we hope to try to cobble together a couple different grants to try to cover a couple people going out as part of that community response team. I also added there the opioid overdose data brief that our epidemiologists put together. I don't think I need to tell you that we have a number of public health issues in St. Louis. We have the STIs, of course, we have homicides, we have opioid overdoses, chronic health disease situations as well. So that's, I don't need to tell you why this is so important. So that's the why. This kind of tells you the what in terms of putting together that team. And Department of Justice looked at the grant that was provided, and they would like us to accept, bless you, the grant for 982.
Thank you for the overview. Do you want to,
Sure.
I guess what we can do right now, we have to take a moment to go around and have the committee members ask any questions. Starting with Alderwoman Hubbard. Do you have any questions about the?
No questions, just a comment. I'm grateful that we're definitely trying to work on this. It's an issue for our city, and we need to do whatever we can to try to address the situation.
You need to do a lot more than this, but this
So
is
it's a start. It's a
Yes, ma'am.
start. So.
Alderman Gunther.
Thank you for being here.
Sure.
So, all right, just trying to, this is pretty short and
It is.
not very descriptive of what really is happening. So we're gonna have an authorized grantee official. So is that gonna be someone in the health department, or will it be someone with like police credentials, or?
What are you referring to a particular line here?
Yeah, so just, I mean, the third line here, so we're
Okay, so
directing
this
the
is,
Department of Health.
so it's the
and they're
city of
authorized.
St. Louis is the grantee of this, and then it goes to the City of St. Louis Department of Health. So we will be the ones who would be administering this on behalf of the City of St. Louis.
Okay, so what exactly are we gonna have, like a task force that's out in the field?
So yes, this community resource response team, we're looking at having some, right, yeah, that's on this detailed summary of the legislation.
Okay,
And so those folks, and if we're able to cobble together a couple of grants, we might actually be able to hire some people specifically for this. They might even be peer support, people who've gone down this road before of recovery, which would be helpful as well. We're not there yet. So we're looking at people within the Department of Health. We will be going out when emergency medical people are out in the field. They are reviving people with Narcan. When the person refuses to get onto the ambulance to go into the hospital, they will say there are some officials from the Department of Health who are here to help you if you're interested. If they're not interested, we're gone. If they're interested, we're there to try to gather some of their contact information, let them know about some of the help that's available from the state, some of the utility assistance that's available, because there's a whole bunch of life that happens in addition to some of these other hardships that they're going through at the moment. We want to try to make sure that we're continuing this kind of pipeline. So now if they go to the hospital, there are people who can help them in those emergency rooms get into a recovery process. It's not always easy, but they're able to do that. If they don't go to the hospital, then they're getting nothing. And so what happens then is that they then go back again. They're looking, because they've just had their high taken down, and they're looking for another opportunity, obviously, to try to feel a little better than they are feeling, because they're not feeling really great at that moment. And we want to try to make sure that we're filling in some of those gaps.
Okay. So you did mention, you said that you're gonna have a response team
Yes.
on site to ask them if they're willing to have help. But like
Correct.
we don't really have anything that like forces people to.
We never do.
Yeah.
No. But, one of the things, Alderman, is that, I think sometimes people get a sense that nobody's there to care about them, and they don't know what resources are there. And over time, if this happens often enough, there will be a window that opens. The window's very, very kind of narrow, and if we're able to reach them at that point, we have no rose-colored glasses. We don't think that most people are going to be willing to do this, but there will be a few, and then we can start that process.
Okay. All right, well, I hope this is the first step in reducing our problems with opioids. So, thank you.
It's going to take a lot more
It's
than
gonna
that.
take a lot more than this, yes.
So, yeah, I always talk about, let me see, that you can speak out, which is if you go to your doctor, find out what sorts of alternatives are available. You can opt out. There's various therapies and treatments in lieu of opioids, and then to throw out the residual excess sort of opioids, because a lot of times this starts very innocuously. You go in for a wisdom tooth, and all the way down the line, and suddenly, you're having an overdose.
Okay, thank you.
Okay, Alderwoman Martin, any questions?
I guess just one sort of overarching question is, I see TANF on here,
Yes.
and WIC.
Yes.
Is there, and maybe a few of these others, I'm not entirely sure, that, if somebody has a felony charge, then, or
Has a what,
conviction,
please?
if someone has like a felony conviction, then they can't receive the benefits. Is there any, advocacy on part of the Department of Health and city, to lobby, to change those laws?
So we're not there really, obviously, at that moment. We're doing the response for part of that. We will have the state is part of this, so they are there, and they're the administrators of TANF and SNAP. WIC is going to have to go through like our federally qualified health centers. All of us can advocate for some of that. So some years back, you may remember that the city did the ban the box sort of thing. So all of these can begin with these sorts of issues. Obviously, it would have to go through Jefferson City and then the
Sure.
federal government in part for some of this. So we have not specifically, and definitely not as part of this, looked at that, but we're always looking at policy changes that can make public health and quality of life better. So if you see an opportunity like that, we should explore that.
All right, great.
Yeah.
Thank you. I think this is a good step forward.
Alderwoman Middlebrook,
I have no question.
Alderwoman Rice.
So the St. Louis Opioid and Homicide Prevention Command Center already
Right.
exists.
It does.
Okay, so and how many staff are in there right now?
So this is where all the different people, we're bringing them together, so
Okay.
it's not really a
So there's not
separate
staff,
staff.
okay.
What we're hoping is that through this grant in part, and perhaps another one that we're hopeful of getting through the state, we could cobble some of that together to get a couple of extra people who could help lift that load when we're going out. We're
Okay.
looking at doing some of this on some weekdays during the day, but also some weekends at night based on what we have so far. But we will be looking more at these predictive analytics to really see where we can focus our efforts because we have scarce resources. So what I'm saying is we don't have a whole bunch of people that are sitting in the health department as part of this. We're bringing these various folks together to do that. So like
Okay.
the police department, the state, you know, the various city agencies. do
Okay,
that.
so this is the 700,000 dedicated creation of the foundation for analytics. So that's, you're really just trying to get that data so that we have something to work off of. when you're-
Correct,
when you're working. Okay.
absolutely.
And then one other question I had, when you talked about the throwing out of
right.
medicines, of,
Right.
you know, opioids and things. I had someone come to me this week and say, hey, I had a bunch of things left over. My wife gave birth and
Right.
we had a whole bunch of opioids left in the house and we took
Right.
them to multiple police stations and no
Right.
one would accept them.
Yeah, that's right. So the South Patrol does have a take-back place.
Okay.
There's a lot of places in the county. You can also get from NCADA. They have these little bags that make them inert when you put water together with this, and you can then just throw it out in the trash can as part of that. They have the take-back days. We just had one. They have them
Okay.
twice a year. And then the hope is, because there's been some recent legislation in Jeff City, and I've been looking forward to this, to be honest with you, is that Walgreens and CVS, if they decide to do this, could set something up there in line with some of the DEA requirements, because there are requirements about how you dispose of all that.
Okay.
But it's a perfect kind of business model, because people are already there. They're gonna be going to the pharmacy. As they return these items, they can also buy some other things, so I think everybody sort of wins in that
Okay,
situation.
so as far as right now, the South Patrol is the only place you know of that is.
For the cities,
Is taking them in this, okay,
right.
okay.
You-
Great, I think that's,
And
so, go ahead.
NCADA is a great source.
Okay.
Also, you can go on to the St. Louis College of Pharmacy. They always have locations. You
Okay.
can go in there as well.
Okay, great. And so when do you think we'd be able to get some feedback coming back from the analytics and things? Like, when would a report?
Yeah, so you probably know that we have a very lengthy RFP process in the city. We also have a long contractual process. I'm thinking that if all went well, probably in April, May-ish, you're
Okay.
gonna, yeah,
Okay, great.
Yep.
Thank you so much.
thank you.
Great, thank you, Mr. Schmidt, for being here today. Is this the first grant of this kind that the city has obtained?
For the opioid issue?
Yes,
To my knowledge, yes.
of this kind. Is that because this is a new federal program, or is this something the city hasn't sought out before?
So the Cures Act and a number of other things in the federal government, you probably know that they're spending a lot of issues on this problem. And the former director and Office of Minority Health from the Missouri Department of Health and Senior Services were very interested in looking at that. We've started putting this together, and as we were doing that, this was in place. And so, yes, there was opportunity together with what we were already doing, and we saw this as a great chance to.
So this was
provide this.
initiated by former director Melba Moore?
Mhm.
Is that who kind of
Yes.
initiated this process?
Along with the state
Okay.
Department of Health.
And are there many cities across the country that are obtaining these kinds of grants, or are we an anomaly in this way?
Yeah, they are, and I can't tell you, I'm thinking that there might have been like 16 or something, but each one is slightly different.
Mhm.
So, for instance, last year, St. Louis County did a community of practice grant, and so they've gotten together with a number of different municipalities and counties throughout the state and really looking at this problem, but not specifically going out to try to deal with in the field like this one.
And speaking of St. Louis County, does this include any coordination or collaboration with that
There
activity
is, so
there?
we're part of the community of practice, we are part of that community of practice, and we're also with the prescription drug monitoring program. As you know, you all sponsored that
Mhm.
last time, and we're all together with that. So some of those data would be part of this, yes.
So we are gonna be coordinating with that effort in St. Louis
Absolutely.
County? I just noticed they
Right.
weren't listed here as one of the main partners
Yeah,
here.
they aren't. What we did do, though, is we made sure what their plans were in terms of this, and they applied last year for what it was that they were doing. We're a part of that. And so this year, we applied for this particular thing, and because the city of St. Louis is the very epicenter,
Mhm.
we're working on that. In St. Louis County, what they are doing is, Behavioral Health Network is trying to coordinate with them. They have a whole bunch of ambulance districts. We're fortunate we only have one. They're trying to put some things together, and as we put this together, we are then looking at trying to bring some of the Behavioral Health Network people as part of ours as well. I see down the road, when this is successful and this is sort of like a beta testing and putting some of this together to make sure how we're gonna get a lot of these things worked out, that more of these analytics will go on and we'll bring it together.
So will there be a proactive component? You mentioned coordinating with the drug monitoring database, so when somebody is kind of pinged on there as abusing the system, we are gonna be using this?
Yeah, we don't have a ping that happens like that. I'm
Well, the
sorry.
prescription drug monitoring
Yeah,
data.
so so what we do is there's data that come from, a lot of that is clinical based and care based, and so we're seeing we'll see some of that information, but you're not necessarily gonna know who's abusing the system. They are starting to look at maybe whether there's certain flags to communicate with doctors and so forth. It's not an enforcement tool, it's more of a trying to help with treatment tool at this point.
Okay, so we're
Yeah.
not preventing that abuse of the system, we're just sort of monitoring it at this point with that drug?
Yeah, so they've been talking about how they might communicate more with doctors and say, there are these other options for you. I'm not sure that they've seen a lot of what we would consider to be abuse. Usually there's some sort of explanation, like maybe they have a lot of cancer patients or that sort of thing, but yes, they are looking at that.
So the grant is primarily to fund coordination between different agencies, if I'm understanding correctly. Is there any funds that the city is looking to obtain that would address the underlying addiction issues? So one of the things that's missing to me in the partnerships here, we're referring people to, we're gonna act as a bridge to wraparound services including TANF, WIC, LIHEAP, Heat Up, Cool Down St. Louis, which is a private nonprofit, housing and transportation. There's all these things, but there's no referral to any agency that offers addiction treatment.
Yeah, so as I indicated, there is gonna be an effort for that, but that's not specifically funded here.
Okay.
So we're working with the state to try to get into a position so that when we're out there, and we're not there yet.
Yes.
But if we can reduce those cravings, what we really need is to have somebody who can administer Suboxone or whatever in the field, because you can't do that by telemedicine. The first meeting has to be with a physician or a nurse who has the waiver from the DEA to be able to do that. And then to try to get them into treatment. Part of that is, as part of these analytics, and we're hopeful we can do this, but we don't want to overpromise that, is that we would like to be in a position that when we meet somebody and they're willing to go into recovery, we can say, okay, we know that there's this treatment and it's available for you next Tuesday at 5 o'clock, and you can go there and get it. Because that's what's missing now.
We don't have those treatment options as far as I understand. The problem
Correct.
that
It
we're
has to be
having.
put together, correct.
But
We don't have that.
do we have, so for example, on the south side, there are a couple of options, right? Is the health department doing anything to identify where those treatment facilities are, what,
Yeah.
openings they have, for
So
example?
the state has been doing a lot with that. We've been meeting with some of the folks who do have that and do have the waivers, yes, and also with Chad and all the rest, but that's an early thing. They work to try to get people into the recovery, as you know. So, yeah, we're working with people, but we don't have that yet.
So is the health department working to kind of develop a list so that when you have somebody who has an addiction
We don't
issue?
have that yet.
But is the health department working on putting
Yeah,
something like
the
that
state
together?
is.
The state is, okay.
Correct, and we're working with the state on that.
So, this looks like a great set of data. I'm curious if we could compare St. Louis to national statistics, where we fit in the opioid epidemic nationally and across the state of Missouri. Is there any data that kind of can inform that?
So-
One of the things that strikes me is that we had 256 opioid-related deaths last year, but the county, with over 3 times as much population, had only 200 overdose deaths. So we clearly have a very concentrated
Yeah.
situation
So,
here in the
so
city.
a lot, as you know, we talked about the fact that the epicenter is the city of St. Louis, and the epicenter of the city of St. Louis is along Highway 55 and to the south.
Sure.
So it's difficult to compare things simply like that, so just taking the amount of population. There are a lot of people, from what I understand, and we will know that, how much we can share, because we can't get into people's personal information. But we may have a better sense, I think we already have a sense now, that there's a lot of people who don't live in the city who are dying in the city
Sure.
as a result of this epidemic. So I think it would be a mistake for us to say that there are more St. Louis City residents who are dying than St. Louis County residents. I don't know that to be the case, but they are dying here.
Do we have that information?
We do not. We have some people have, somebody has some pieces of this, but they don't know that exactly, I wouldn't think. Now, we know who dies,
Do we
and
know
and
what their
where
home
it was
address?
reported, but that kind of information is generally very, that's a person's individual information. I don't have that. As I sit here, I don't.
Sure.
Yeah.
I think it might be helpful if we could kind of understand who's dying in the city, whether they're city residents.
That's why
and
we're
whether-
trying to put some of this
So that's part
But
of
more
it.
importantly is to know where they're dying, when they're dying, how that's occurring, so that we know where to put those resources. That will help us not only in terms of this early intervention,
Mhm.
it can help on that prevention side that you're talking about as well.
Sure.
So when you were talking about prevention earlier, CDC put out all these guidelines, and doctors are doing more things, and we're looking at, even the throw out and the
Yeah.
talk out, all of those are preventative pieces, but not all of it is just in the one piece of.
Yeah, I think we ought to talk too about prevention and treatment.
course.
These are
Yeah.
things that are not readily available to St. Louis City residents, and something I'd like to see the city do more to bring into the city, because we do know a lot of our residents are experiencing addiction, they're dying from it.
Right.
We've had a couple, as you know, opportunities to have treatment facilities in our community. There has been opposition, as you are aware, and we're part of, in the Grabway Park neighborhood. But we need to have healthy conversations about what treatment facilities can do and what and the need that we have for them within our communities in order to start addressing this, not on the back end when people are dying, but on the front end when people are
So one of those would
experiencing
be
addiction.
the federal level in terms of the DEA waivers,
Sure.
to allow more people. And also doctors who would be willing to do that because they view enough, that they get enough in return for it in order to be able to provide that.
And I'm hopeful that the health department, and maybe you in particular, could work with the community, the city as a whole, individual neighborhoods, to maybe be more supportive of treatment facilities, and preventative measures to address the addiction issues that we clearly have on the front end.
Well, as
Um,
you know, the devil's always in the details.
Sure.
So I could go in and say I have a 12-step program, but that's not really the best way to approach it these days. The medically assisted treatment is viewed as the better standard
Sure.
and the more appropriate. So there's a whole bunch of things like that go into it. And so, all of these communities have to balance a whole lot of things together when they're looking at these, some of which affect various aspects of the quality of life, including the overdose situation.
Well, and I think that's where having some recommendations from the health department, whether it's the city health department or the state health department, on which treatment facilities are doing a good job, especially those that have been operating in the community for several decades, with good track records. If we could find ways to be supportive of those and those initiatives, I think it would go a long way.
So we're not likely to know that,
Sure.
because we are a core function public health department. As you know, we don't do any clinical other than TB and HIV, and this is not clinical either, so.
Sure.
yeah.
Well, and perhaps your efforts just as an individual citizen supporting those things could be helpful moving forward. And with that, I think what we'll do is I'll entertain a motion to pass Board Bill 132 with a do pass recommendation.
So moved.
Second?
Please call the roll.
Alderwoman Hubbard,
Whoop.
Alderwoman Green, Alderwoman Spencer,
Aye.
Alderman Gunther,
Aye.
Alderwoman Martin,
Aye.
Alderwoman Navarro, Alderwoman Middlebrook,
Aye.
Alderwoman Rice,
Aye.
Chairman Ornowitz, 5 aye votes.
And with that,
Vice Chair, can I have my name to the bill?
sure. And with that, Board Bill 132 passes out of the Health and Human Services Committee with a do pass recommendation.
Thank you.
Seeing no other items on the agenda, I'll entertain a motion for dismiss.
Move we dismiss?
Adjourn?
And
So moved.
if you don't want
Thank
to
you.
adjourn, you have to stay.